Comstock, editor-in-chief of pharmaphorum, and I'm here at the WeWork in Union Square in San Francisco. It's day 2 of JP Morgan, and I'm joined by Phil Johnson, the new-ish Chief Commercial Officer at Evidation.
That's right, 4 months in.
Yeah.
Yes.
So for the folks who don't know Evidation, maybe just a quick explanation of what you guys do, and then we can sort of dig in a little more.
Yeah, absolutely. I mean, it was founded a little over 10 years ago with the idea that, hey, the best way to help people live healthier, longer lives is to reward them for making healthy choices. Generally, no one celebrates when you hit your step goal or you make healthier choices. And so a really awesome group of founders developed an app that people would connect their wearables to, track a lot of their health data as they made healthy choices or got better sleep or took more steps or even decided to participate in research. They got rewards, and those rewards could be converted to money for themselves, or they could contribute that to research. And so that's the foundation of Evidation. It's now 10 years later, it's 5 million people who've connected their wearables to our platform, and we're still rewarding people for making healthy choices.
It's interesting because you can look at it from both sides, right? That's the patient-facing, consumer-facing side. But then on the back end, what that gives you is this tremendous amount of data, and then you can do things with that. And I mean, I don't want to say sell it to other people, but it creates a platform, right?
Yeah, well, we think differently, slightly differently about it, that it's still those people's data. Mm-hmm. We're their custodians and stewards of their data. And so we build a lot on trying to make sure that data is really well protected and private, and everything that they do is consented. And then really it's their opportunity. We're almost like the middleman. Hey, if your data can be used to accelerate research in women's health, in obesity, in Parkinson's disease, would you like to be a part of that? Because your unique lifestyle makeup and sometimes your genetic or genomic profile is exactly what these people need to figure out whether a drug can help them with their disorder or their disease. And so we find that upwards of 90% of our members are excited about that. Not to mention they do also get rewarded for it.
Yeah. So that's super interesting. Before we go too much further, I'd love to hear a little bit about your background and how you came across Evidation and what made you want to move here.
Yeah, so ironically, I've known Evidation for a long time. I was at Amazon Web Services, where I built a healthcare and life science commercial team. And Evidation was one of our customers.
Okay, of course.
So I had somebody else covering Evidation. It was AKA Achievement at the time, actually, on all my reporting dashboards. So I got to know Evidation from afar, but had an incredible time at Amazon, and it led me to actually one of my other customers, Tempus AI. They went public last year, and I joined Tempus in 2020 during the pandemic. But I had a very strong relationship with their whole C-suite. Eric Lefkowski, who's their founder, he was the founder of Groupon, founded Tempus after his wife got breast cancer, and his whole position was, if we can use data to figure out where we should go, the best way to go for dinner tonight, surely we should be able to use data to pick a great treatment option for my wife, and that option didn't exist. And so he built a company to basically generate data and then analyze data to give back to clinicians to make healthy choices, make therapeutic choices that were specific to the patient. And so I worked there for 4 years helping build their real world data business. And so I've been immersed in cancer data, drug discovery using real world data for the last 4 years. And Evidation had actually been reaching out for a while, and I wasn't super interested, to be honest, because I just thought it was all kind of like a CRO is what I had in my head, and I was really wrong. I spent those years at Tempus, and they were great years. We really grew the business, which was fun. But all throughout those years, I was just getting from pharma, hey, this is great data, but how do I go and talk to this patient? Mm-hmm. Hey, this patient is perfect for our trial, perfect for this therapeutic. It could save their life. But real world data, the whole industry is like fundamentally flawed in that all the data is de-identified to protect patients. But then those patients who could benefit, we can't contact them because we don't know who they are.
Right.
And that's because none of the real world data companies are direct to patient. They all go through the institution, or they all go through the doctor. And Evidation is direct to patient. And so the light bulb for me clicked that I went, they are not getting approvals fast enough. They're designing trials that don't work. They're not getting drugs into patients' hands. The data they're using is not representative. And Evidation's, because they're direct to patient, can solve all of those issues that I've been hearing about. And so I reached back out to them once I connected the dots. I was like, we really got to talk. And then became super impressed with the leadership team, Deb and Leslie and Christine. And so then it became kind of smooth from there. But I was very sold on the problem that Evidation can solve for drug developers.
Yeah, that's kind of exactly what I was going to ask about next. Is you mentioned earlier that you think there's a lot of buzz and a lot of talk about real world evidence, but Evidation has a different approach.
That's right.
Yeah.
Yeah, I think I've lived with these drug developers and epidemiologists and data scientists, as well as those who are in clinical development. And one, the data is messy and the data has so much missingness, and there's no mechanism to solve it because none of these real data companies can talk to patients.
Yeah, they can't even go back to where they got the data. They can't even check that electronic health record and see why it's fragmented.
Even very few of them even are truly connected to the EHR to have the real-time updates that are necessary. And so that limits what real-world data can do for the drug developers. The other thing that's interesting is that although healthcare data is like gigantic, like 30% of the world's data volume is healthcare data. Every pharma company says they don't have enough data. It's not that it doesn't exist, it's that no one has access to it. And the way that at least in America, the way that our healthcare system is set up, there is no way of breaking down those silos. It's not that people have bad intentions, it's just the structure in the system resists sharing.
So you have to do an end run around the system entirely and just go to the patients.
So instead of going to 100 hospital systems, you have to go to 5 million individuals. It's not fun. It's hard, it's expensive, and that's why no one does it. And that was not Evidation's, I think, original design, by the way. I think we find ourselves in this position where we are uniquely connected to all these different people who can help solve some of these problems that drug developers are having because they don't have data.
Right, because the other piece is what you said at the beginning. You've created an incentive for people to give that data, and not just an altruistic incentive, although it sounds like that is a big part of it too.
It's both.
Yeah.
It really is both. I do think that the rewards are what get them in the door.
Yeah.
But I think it's been proven that the real value is that they're contributing data to something that makes real impact. But remember, we are also providing personalized recommendations back to our members. So they are getting like real-time, personalized, customized recommendations, whether that could be an education piece, that could be someone with sleep apnea who doesn't know they have sleep apnea, but because they've connected their Oura ring, we can tell that their sleep disturbances are so significant that we're going to send an at-home sleep diagnostic test to them. Like, we can do so much for our members. So they don't just stay just for the money or the research. We actually are helping them make healthier choices, which I think is the fundamental mission of the company.
So as a data company, you are sort of also front and center, ground zero for everything that's been happening with AI over the last few years. I mean,
we are.
You've got to keep up with that, I assume.
Yes,
how has that kind of changed what you do? How are you future-proofing as the nature of AI changes so fast?
Yeah, I think that AI is exciting. It's fun. It's going to be transformative for healthcare. I think that the lowering of low-cost compute has opened it up to everybody. I know that well because I was at AWS and I was dealing with that explosive infrastructure needs. But I also think that relevant data is critical for AI to really take off in drug discovery. So I'll give you obesity, for example. Right now, none of these companies have molecular data on people who are taking Ozempic or Zepbound or any other weight management intervention. So they don't know the changes in biology. They just know people are losing weight. Their mental health seems to be getting better. Their substance abuse seems to be getting better. Some people's liver function seems to be getting better. Cardiovascular health seems to be getting better, but we actually don't know why. So in order to do that, you've got to have enough data that's specific pre-treatment and post-treatment in the hands of these teams. They're building incredible generative AI teams at all these big pharma companies, but they don't have data.
Yeah, they don't have the right data.
They don't have the right data to train these large language models. And so I'm not sure if we're going to be trying to build the most sophisticated algorithm that exists in drug discovery. We are going to build some simple ones that can build some correlative data, causality. We can do some early detection, that's for sure, with our wearable data. But really, we want to get the data in the hands of these armies of data scientists to start really building these large language models so that we can learn about these diseases faster and then hopefully create more drugs that apply to the patients faster.
Yeah, I mean, it's kind of the double-edged sword of, right, using more synthetic data and being able to replace costly trials with algorithms, is huge benefit. But if the data's not there, if it's not perfect, you're just going to get further and further away from actual truth and actual results that are meaningful. Right?
That's right. Well, and the hope is that generative AI cannot help us treat disease, but it can help prevent disease. That would be the hope. So if you want to do that, then you have to have data on people before they become patients. Like our whole healthcare system is like, a sick care system, right? They enter into the EHR and claims data world when they get sick, but they lived this whole life before that where the disease was progressing and they didn't know it. And so I loved Evidation's approach of building relationships with people, not patients. So now I've got wearable data, potentially EHR data, all kinds of patient-reported outcome data previous to you getting sick. If I could put that data in the hands of Eli Lilly and Amgen and Pfizer and Novartis, now we can start to build therapeutics or potentially just lifestyle changes, but we can build things that can help either detect disease really, really early or prevent disease, which we're being asked to do quite a bit now. We're a little bit surprised at how much in obesity, I'll give you specifically. There is a strong desire amongst these large pharma companies to prevent obesity, which is ironic. You wouldn't think that.
Cynically, you would think now that they have a blockbuster treatment for it, they want as many people to get it as possible. But they can't keep up with the demand.
Well, and I think they know that between childhood obesity and adult obesity, the market's large enough. But there's a whole other side to this, that there are people who are approaching obesity or right on the verge of obesity. And there are things that can be done to either slow down that progression or stop that progression. How do you find those people?
Yeah.
You can't find them in the medical system because they're not patients yet. And so there's a lot of pharma companies interested in building algorithms actually for early detection for obesity. They need us because they need that kind of data. So again, I think generative AI is going to be incredible, but you have to have someone who's really good at data generation, and then the harmony, the harmonization, the normalization, the structuring, the storage, the delivery, all the really boring stuff. We're really good at that.
Yeah.
So they need us, and together, then we can make the advancements.
That's really interesting, and the notion that there's just no visibility on healthy people in the healthcare system because it's a sick care system, right?
Yeah, exactly. It's unfortunate, but I do think you'll find, my belief is that in the next 3 to 5 years, you're going to find some very unlikely players helping the healthcare industry make advancements because they didn't build relations with people when they became patients. They had relations with them before. Mm-hmm. And they're not going to be what you think. It will be unlikely folks who, for whatever reason, were collecting wearable data and discovered that their wearable data that they were extracting through whatever app is the key to understanding the life patterns and the quality of life metrics. Neuroscience is another big one. Detecting cognitive decline. Maybe a mobile game could detect cognitive decline better than an EHR.
Maybe the moment that it starts happening,
exactly,
rather than once it gets so bad that loved ones notice it.
Exactly right. Like, who can detect? Maybe there's a deterioration in the retina that only a phone could detect when they're playing Candy Crush. You know what I mean? Like, I just think that there is going to be a real shift in how we think about healthcare data in order to solve these problems. Because again, generative AI needs all of that data to be effective. It can't start at the moment you get diagnosed.
Yeah. Someone on one of the panels this morning, I was at the Fierce JPM week. I think it was, her last name is Khan. She's with Recurgent.
Najat Khan.
Najat Khan.
Yes.
Yeah. She was talking about how, there's no one right now who has a complete longitudinal data set about their health.
Correct.
It's all in whatever different health records you were at when you were a kid, and then when you moved, and then when you moved again. And even if you had one doctor your whole life, like, it would be very spotty data.
That's right.
And so the notion, like, that, all of this has been happening, but only in the last, your generous 20 years.
That's right.
So what will it look like when we've been collecting data long enough that we capture an entire life, and what can you do with that?
That's right. Yeah, I worked with Najat when I was at Tempest. She was at J&J, and we did quite a few research projects around longitudinal data for various cancer types. And again, the struggle was, and if you look across therapeutic areas, really, I struggle with migraines. That's not in any EHR, and it's not in any claims data that you could find on me. So even though I have access to all that data and I could give it to you, say expert, you would never know. And so you're going to have to find a way to passively but continuously collect longitudinal data on people to really help them arrive at health.
Yeah.
And that's where I think that everyone thinks through the lens of EHR, maybe molecular data, claims data, that's real world data. And that is fundamentally limited. And so we're trying to break that mindset because we think there's so much more insight available into these other modalities. Not that we want to get rid of them. We just want to include them in that whole context and then put that in the hands of people who can really innovate.
What do you think the next steps are? What are you thinking about as you think about 2025, 2026, 2027? What are kind of the big goals, especially, coming into a new position that's not really that new to you because you've worked with this company for a long time?
Yeah, I mean, I think that, I'm pretty excited about the team we have. I think that, we prioritized empathy as a quality that we have in everybody that's a part of our group. And I think that's critically important, even for people who are selling. I think they have to have a reason why they do what they do. And I think that myself, so I have a weird background. So previous to working, I worked at Oracle and Amazon and Tempest, but previous to that, I was actually in the full-time ministry.
Oh, wow.
Working with high school students and college students and single professionals, eventually married people. My wife and I worked together for 10 years, building tons of community programs. And so I think service is a big, deep conviction of mine. And I found that the most effective people who build companies have that mindset. And I think as we look at what's important to people in pharma, I would say obesity is an area that's very important. I think both parents feeling concerned and worried about their children who are trending towards that direction, as well as people who are adults like me getting older, and you start realizing so many of my health problems would be solved if I was at a different weight. And so I think we're really excited about innovating in the area of obesity. I would also say that women's health is an area I think we have a particular strength in. Our platform has a robust volume of women who are trying to kind of biohack their health. I think it's horrible how little investment goes into women's health. And so there's some pretty interesting data sets that we can build. And you're seeing more and more companies invest in it. We just heard Jill Biden speak
right.
about it.
And what she said was that, that there's just like such a long history of women being excluded from health research. That's right. That they're just not in the data.
They're an afterthought.
Yeah.
Yeah, it's wild. There are reasons for that, but we're not going to necessarily try to rehash the past. What I think we can do is build really interesting multimodal data sets and get them in the hands of people who are passionately building more therapeutics or sometimes just diagnostics, right, to help. I think she said that women's bodies go from being a miracle to a mystery. I think that's because there's a lack of diagnostics in women's health. In order to build great diagnostics, you need data. And so before we can get to the therapeutics, sometimes we have to get to the diagnostic. And so we're pretty interested in doing all those different things in 2025.
Awesome. Well, very exciting stuff. Be interested to see what comes next. And it's really great to make the connection and to meet you, Phil.
Absolutely. It's great to meet you, Jonah.
Have a great show.
Thank you. Appreciate it.